Measuring cardiac output is a cornerstone of hemodynamic monitoring, moving historically from highly invasive gold standards to modern non-invasive digital approximations. The primary clinical modalities are categorized by their level of invasiveness, mechanism, and mathematical principles. Among the invasive methods, that is the traditional standards, the direct Fick principle is based on the law of conservation of mass. It assumes that the rate of oxygen consumption VO2 by the body is equal to the amount of oxygen taken up by the lungs. The formula cardiac output is equal to VO2 divided by the difference between arterial and venous oxygen content. CaO2 is arterial oxygen content and CvO2 is mixed venous oxygen content sampled from a pulmonary artery. While considered a gold standard, true direct Fick requires a metabolic hood to measure actual VO2. In most cath labs, indirect Fick is used, substituting assumed metabolic rates based on age and sex, which introduces error in hypermetabolic or critically ill patients. Indicator dilution and thermodilution. A known quantity of an indicator, originally it was green dye, indocyanine green, now it's called saline, is injected into the right atrium via a pulmonary artery catheter. A thermistor at the distal tip measures the temperature drop in the pulmonary artery over time. The formula, Stewart-Hamilton equation. It's a very complex formula where V is the injected volume, Tb and Ti are blood and injectate temperatures, K1 and K2 are correction factors, and the denominator is the area under the thermodilution curve. While it is highly accurate, it is prone for errors in the presence of severe tricuspid regurgitation, intracardiac shunts, or rapid fluid infusions during measurement. Moving on to minimally invasive methods. Pulse contour analysis. These systems utilize algorithms to analyze the arterial pressure waveform morphology obtained from an arterial line. The area under the systolic portion of the curve is proportional to the stroke volume. Uncalibrated methods use demographic data and waveform characteristics to estimate vascular compliance (CT) and resistance.